Today we will discuss about the rickettsial infections. Rickettsial infections uh, which were not previously that common in India, but now these are become much and much more common due to the availability of testing these infections, because previously there was no serological investigations available for the rickettsial infections, especially in our state. But nowadays, as facility for testing these infections are available, so incidence and diagnosis of these illnesses is being made more frequently than it as compared to previous times. Okay, so what is rickettsia? Rickettsia are small gram negative bacilli. um, these are considered as bacteria, but they are like more than a link between bacteria and viruses, because these are obligatory intracellular parasites. Okay, so uh, to be active or uh, to be alive, they need uh, they need to be inside our cells. So these are link between bacteria and viruses, and these are mostly transmitted by the arthropod vectors. Now, what are the organisms which falls under the Rickettsia family? These are Rickettsia, Aurantia, and Ehrlichia. So these three uh, genus are falls under the Rickettsia family. So we broadly divide rickettsia in two groups. One group causes spotted fevers like Rocky Mountain spotted fever, or uh, another group is typhus fever group. In organism of this group causes typhus like murine typhus or epidemic typhus. Okay, now these are different groups and their causative agents as well as their vector. So most important for our region is this scrub typhus. It is classified in a different group as compared to typhoids and this spotted fever group, because this is caused by Aurantia shustugamushi. This scrub typhus is widely common in India, in Maharashtra, in MP, in our state, in our region, also in UP and uh, around Delhi, more widely UP and Haryana side. Okay, so this is caused by chigger or larva of trombiculid mite. Another important uh, rickettsia is this Rickettsia conuri. Okay, it causes Indian tick typhus. Okay, and it is spread by the ticks which are found on the rodents. Another important thing is this scrub typhus. These mites are found on rodents as well as on dogs. So this rickettsii, this causes Rocky Mountain spotted fever, which is this rickettsia is common in America, and it is also caused by tick, and this tick is widely found on the dogs. So dogs are a reservoir for these ticks. Another important thing about these ticks is that these ticks require warm temperature Okay, so if we remove tick early, then chances of spreading this rickettsia is decreased, because when tick attaches itself to our body and starts sucking blood, then as he feed on the blood and warmth of the blood reaches to this tick, these rickettsial become activate, and only after being activate they are transmitted to the human. So if tick is removed within 6 hours or around in between 24 hours, so there are decreased chances of catching this Rocky Mountain spotted fever. Another important is Rickettsia typhi, which causes endemic typhus, and it is caused by rat flea. Okay, this is also found in especially in cold places like Himachal Pradesh, Jammu Kashmir, okay, China. And this Rickettsia provozaki, this causes epidemic typhus, and this is caused by louse, and this is also common in cold areas. Okay, so these are different type of rickettsial illnesses which are found in human beings. Important one for our region is scrub typhus, and in India others are epidemic, endemic, and Indian tick typhus. Okay, so these are common in India. Now we will discuss about scrub typhus. In typhus groups, the pathogenesis is almost common. Okay, so we will only discuss about this scrub typhus and pathogenesis, treatment. These things will be common for this typhus group. Okay, and Rocky Mountain spotted fever, it is not important for our region at present. Okay, now scrub typhus, this is the pathogenesis which involve the scrub typhus disease is we will found widespread infection of vascular endothelial cells. These rickettsia, Orencia shushugamisi, these invade our body, and these are spread by the larval stage of trombiculide mite. And when these larvae feed on human blood, they release these Orencia into our body, and these Orencia go inside the endothelial cells, and there they start replication and they cause infection of this vascular endothelial cell, and this lead to widespread vasculitis. Is inflammation of vessels, and also causes perivascular inflammatory lesions. So basic pathogenesis is vasculitis of blood vessels. So clinical features and signs are most of the vasculitis, and complications are also due to the vasculitis. So this is the basic pathogenesis of typhus, especially scrub typhus, and other kind of typhus also follow this pattern. Okay, then another important thing is that what our body does in response to this vasculitis. It is not well studied in case of what our body does is not well studied or researched in case of scrub typhus, but in case of Rocky Mountain spotted fever they have studied and researched more about what our body does. So the basic mechanism is same. In Rocky Mountain spotted fever, after this vasculitis sets up, there is a cytokine storm which causes increased secretion of interleukin and tumor necrosis factors, also another cytokines, and this cytokine storm leads to the signs and symptoms in that disease. Also there is increased thrombosis in case of Rocky Mountain fever as well as other rickettsial illnesses. Now clinical features of scrub typhus, more common feature or Non-specific feature is fever. Fever is usually prolonged more than 1 week or around 1 week. Okay, another important thing is generalized lymphadenopathy is there. Patient also present with hepatosplenomegaly, and gastrointestinal symptom like vomiting or diarrhea also can be found. This painless eschar is found but not in that much of cases. Less than 50% of patients present with this scar. Also a maculopapular rash, which we confused with the meningococcemia or dengue, is also seen. Okay, so this picture mimics other common illnesses which are found in India, like meningococcemia, malaria, dengue. So differential diagnosis for scrub typhus are all these diseases. Okay, when we do not have laboratory testing or serological testing for scrub typhus, then due to these illnesses we miss the diagnosis of scrub typhus. And another what laboratory findings we can see, we can find thrombocytopenia. Around 50% patients present with thrombocytopenia, so this will also make it difficult to differentiate from dengue. So we have to see for other features of dengue or mostly lab testing. So these are, then leukocytosis can be there. Now how do we diagnose scrub typhus? We have to do a fluorescent antibody assay. Okay, so if we found these antibodies in the blood of the patient, then it will diagnose scrub typhus. Another important thing is that in initial phase of illness, these antibodies are not formed inside the body, so serological test will come negative for the scrub typhus, because antibodies usually formed in after first or second week of the illness. So in initial stage these antibodies can be negative or can be present. Another important thing, when we do CSF, because patient with scrub typhus can be present with meningoencephalitis like presentation. So in case of CSF, non-specific mild mononuclear pleocytosis can be present, but glucose level of the CSF will be normal in case of scrub typhus. Now what are the complications? So these complications are due to that cytochrome storm. Okay, patient with scrub typhus or other rickettsial illnesses can present with pneumonitis, meningoencephalitis, acute renal failure, myocarditis, and septic shock like syndrome. There are other rickettsial illnesses in which we can also found gangrene or widespread purpura fulminans. And another catching point for that rickettsial illness which differentiate patient from meningococcemia is that in case of rickettsial purpura fulminans, patient are not sick. They in case of children, if that children is infant, that child will be well breastfeeding and present with widespread purpura. Now how do we treat? So there are antibiotics which are very effective for the treatment of scrub typhus. Most important, doxycycline we usually use in child more than 8 years of age, but in case of rickettsia, if no other option is there, it can also be used in child less than 8 years of age. Okay, So dose is 2.2 milligram per kg per dose. It has to be given twice a day, but maximum dose is 200 mg per day. We have to give doxycycline at least after 3 days of fever, when fever subsided. Okay, usually fever, we have to give it 5 to 7 days, but in case of complication more than 10 days of doxycycline can be required. It can be given both in intravenous form or oral form. Okay, another is, if there is any contraindication due to doxycycline, then we can also give azithromycin as second line drug, and dose is 10 mg per kg per day on first day. Then we have to give 5 mg per kg per day. Maximum dose is 500 mg per day, and it can be given up to 10 days or more as per patient's requirement. Another things are supportive therapy, which we have to give as per the patient's requirement. Patient can present with meningoencephalitis like or acute encephalitis like presentation, so anti epileptics can be used. We have to give proper respiratory support. Okay, so supportive therapy is most important along with these antibiotics. Now this will sums up our topic on the rickettsial illnesses. Thank you.